do want to make a comment that yes, we know there's a lack of custodians, but the correlation between a dirty building, excuse me, and a lack of custodian is not associated or correlated with the uptick in the COVID cases. So again, the science proves that. That's the data. So again, I want to say that just because the one custodian, and we're working on that, we're working very hard to honor their work, to make sure that teachers, especially kids, have a optimal, clean learning environment. But again, we're here in collaboration with our expert, our resident expert for the region, Dr. Ocaranza, to help hopefully curtail these COVID cases that we're seeing, not only here in Canutillo, but across the county, across the city.
Talk about some of the things that, like you said, you guys are going to be cleaning. Talk about some of the things that you guys are going to do to try and stop this upwards tick in cases.
Well, a lot of it is the school building, right? We can sanitize, and clean the school, but what's happening outside of the school? How many of our kids our parents are taking advantage of the vaccine clinics that we're having across Galaviz? How many people got their boosters? So again, how many people are wearing masks? Again, it doesn't help that, very respectfully, that vaccines is a given science that are proven to curtail or help the spread of COVID, but yet we have a governor that won't let us mandate it. It doesn't help us either. I mean, again, you're trying to hold us accountable without the power to act, without the power to take action for our community. I can't speak for other communities, but again, we're going to sanitize, we're going to clean, we're going to on Saturdays come in, make sure our buildings are up and down, clean for a Monday morning when kids come back. Yes, ma'am.
Superintendent Galaviz, come Monday, how do you ease the minds of parents who are worried for their children to return?
I mean, that's part of meeting here today. You know, I was meeting with a dad this morning and a husband of and you know, they're scared, they're concerned. You know, I'm scared and I'm concerned. And then again, that's why we're here today to ease the fear and take the opportunity this weekend of what do they do at home? Are they wearing a mask? Are they out in public? You know, are they vaccinated? So again, I keep saying vaccinate, vaccinate, vaccinate. You know, use those protocols. Watch your distance. Sanitize. You know, wash your hands. So those protocols, safety protocols that we put in place when COVID came out, are the same protocols that we use today. And I think many of us have been laxed in what we do outside of school and outside of our work. And this is just a reality check to say, hey, COVID's still here.
Do you know how many members of the district or how many students are vaccinated?
No, we don't. Again, our governor doesn't allow us to ask. Well, we can ask, but it's voluntary. It's you know, if you want to tell us, you can, and that comes with staff. I mean, that would help a lot. Again, that's why we keep pushing clinics and clinics, but it'd be helpful. Like again, we have vaccinations when the kids start school, and they can't come to school until they're fully vaccinated. Why vaccination and wearing a mask has been politicized? I don't know. You know, all I know is I can control what I do, and we can offer and ask. And again, we have Dr. Reyes and Dr. Fuentes and Nurse Berubin, our resident COVID experts here in the district, that guide us also in those decisions. And then we had a clinic yesterday for Veterans Day, you know, and there was a long line. We had a clinic also at the high school on Wednesday for the flu shot. Also get your flu shot. So go ahead, sir.
Sure. You know, just on that, I know that there is a court case concerning the mask mandates for students with disabilities. Is the school district looking at that court case and trying to implement those, you know, what's being argued in that court case, or are you all just going to let that litigation play
You know,
out?
it's like wear a mask, don't wear a mask. You know, and again, it's politicians putting the health and safety of our students and staff. And right now, we want to honor Governor Abbott's decision of not mandating masks. because again, you don't you also we're also in a crossroad in a peril of teaching kids to follow the law. And right now, until when is it going to change? Every week it changes. So again, we want to give parents, and especially our kids with disabilities, that option. I encourage you to wear a mask. We wear a mask. Watch your watch your distance, wash your hands, and now get vaccinated. So again, we want to be out of the courtroom. That's not what we're here to do.
Are you kind of hoping that maybe with these couple of days that the students have to stay home, are you hoping that the parents kind of like take that as a learning experience to say that this can come back and hurt the school if they don't do something at home?
Well, you talk about freedom, right? And I served in the military to honor and protect. We talk about the freedom of free public education, but this isn't free to run these schools. It's not free because we're paid with our formula with butts and seats. So when you have low enrollment, you know what? You lose money. So again, we want parents to take this, and everybody, as a warning that COVID is still prevalent. It is still here in our community. And again, we need to work together in order to help mitigate the circumstances and the consequences surrounding COVID.
So, I mean, we've seen kids in schools for months, right? What are some of the factors causing the high increase in COVID cases?
A lot of it, kids are back in session, and you can have up to 22 kids in a classroom. So we have 22 kids in the classroom, right? The teacher, you can tell them to wear a mask, but again, when you're a first grader trying phonics and they need to see the teacher's lips move, again, it's part of teaching. It's part of what we do. Again, we encourage vaccinations. We encourage mask wearing. We encourage washing your hands. And so, I mean, we don't we don't want to stop. Life doesn't stop. So right now, it's how do we work together in order to create that learning environment for our kids and our staff.
So we've been looking at the numbers of COVID cases, and once the mask mandates were no longer being enforced, we did see those numbers starting to increase. Is that something that you guys are seeing?
Yes, we're seeing that. We're seeing the correlation between, again, events that are happening, school functions going on, and again, we want to honor the relationship we have with parents. Again, this is a relationship we have with them. Again, it goes back to the question of easing parents. That's why we're here. It's serious. We're scared. We're concerned. We hear you. We hear your frustration. I don't like your babies being out of school. We know there's a gap. We know that remote conferencing shows marginal results.
And I can speak to that.
And then with that, I'll let Dr. Ocaranza. I didn't know he was so tall. I saw him at Zoom. But again, we work together. This is a collaboration for the benefit and safety. And I'll let Dr. O.
Before you step away, sir, just one more question. Once students come back, is there anything that you're going to do as a district to maybe stop after-school events, stop or cancel other things, or are you going to let everything go kind of as regular?
Right now we're requiring principals to send plans, and then we're going to have our COVID experts, Dr. Fuentes and Dr. Reyes, and then even we send them to Dr. O for him to verify and look at, where are your safety protocols, making sure. Yeah, this is a collaboration because we don't want to stop life. We don't want to go back to when there's a vaccination out there. Get vaccinated. Wear a mask. Wash your hands. Sanitize. Follow the safety protocols. But again, to answer your question, they're going to be submitting their plan, and we're going to work together. Right,
one last question, Superintendent Galaviz, I'm so sorry. Obviously, with Thanksgiving coming up in 2 weeks, the holiday season ramping up, we're almost there. What are you Are you concerned about students coming back to school possibly sick with COVID?
Well, yeah, we're concerned about that. Again, it goes back to outside of those gates. What are they doing? That's why we have rapid testing teams. We're also going to implement a stipend for those rapid testers as of $500 to help us out. And we encourage that, parents, watch, the symptoms at home. A lot of parents are sending their kids thinking that it's just allergies. My wife's a nurse practitioner for Dr. Enriquez, Franklin Medical Center. I gave her a plug. So, that's what she's seeing, that parents are saying, I just have allergies. No. And then when they test, you have COVID. So when you see those symptoms at home, keep them at home. Get them tested.
Dr. Galaviz, I do have one more question. Sorry to
Oh.
throw. By 5 p.m. on Wednesday, parents had already been informed that Jose Damian and Galaviz Middle School would no longer, they'd go into remote learning. But there was still a basketball game at Galaviz Middle School. Could you walk me through that decision-making process?
Well, the decision was made just because those kids in general, again, we have rapid testing for our athletes, but those kids did not show any symptoms. So, again, the decision was made to have the basketball at CMS.
Okay.
So at that time during the day, it was a quick decision. We looked at it, and, are these kids part of the close contacts that were sent home? And the basketball team was not.
Okay, but still, if the basketball team had been tested, there's still parents and, their schools, kids are in elementary school, middle schools, different schools, how would you know that wasn't spreading? Because there are a lot of cases amongst many of the schools.
That's why we have rapid testing. That's why rapid testing is there, not only for our students, but for our parents and our staff. All this morning we've been doing rapid testing for our community. It's not just kids and staff. It's for everybody. So, how do you know right now? How do you know any of you? You don't until you have the symptoms. You may not have the symptoms, or hey, I was at an event, and let me go get tested.
So Anthony ISD also says that they were not made aware of the positivity rate at the school. Do you feel that that's something that they should have been made aware of?
Yes, I do. And I think that's the communication gap between the superintendent and I. And I called him yesterday to apologize, to say, that's part of the communication. It's just not gonna deal. It's tonight we're gonna have the playoff, the football team, right? For Go Orange. So it's just part of opening our communication. And I think a lot of the things in talking to the principal who feels bad. And it's like, don't feel bad. This is a virus. It's here. Don't take it on your shoulders. We need to work together and be open. Don't hide. And I think that's why we're here today. We're not going to hide to say that we have an uptick in COVID cases as a result, but so does the county. And that's why we talk together and collaborate. And yes, I agree with you. Again, calling that superintendent yesterday on Veterans Day to say, sir, I'm sorry. Because now he has to answer questions. And I don't want it. Worst thing is, like I tell all the superintendents, when one of you are in front of the mic, good or bad, we all are in front of the mic, good or bad. So again, only together, like when the onset of COVID, we came together with our delegation to work together. This is another opportunity to come together and work and realize we need to be more proactive.
And so in hindsight, do you still stand by that decision to host that game at a school that had to go into remote learning?
Yes, I do. Ready? Oh, yeah. Okay. Thank you.
Yes. Now I can have a job after this.
Just one quick minute.
Good morning. 1 minute? No.
30 seconds.
Very good. Thank you very much for being here, and thank you, Dr. Galaviz, for the invitation, because this is a way to show that we're in close and constant communication between public health officials and school officials. And this is not exclusive to Canutillo, but we have been providing that guidance and recommendations to all the school districts in the region. We know that the pandemic is here and it hasn't gone away. We see the numbers climbing up, and they're climbing rapidly, as you all are aware. We just doubled the number of cases in the 7-day average in just about a month. Hospitalizations continue to increase, and unfortunately, even though we don't see that the percentage of COVID patients hospitalized has climbed so rapidly, there are still hospitals treating other patients with the influenza, with the diabetes, with the heart attacks, and the space is limited. So when Dr. Galaviz spoke about the challenges that they have with the janitorial staff, it happens with the teachers, it happens in all the healthcare system as well, because it's hard to recruit nurses to staff a bed. So many challenges have been discovered, and even with these challenges, when there's always a challenge, there's always a possibility to do things better. And that's why we all come close and come closer as a community, and that's the way that we've been trying to fight this pandemic. From the beginning of the pandemic, public health and school districts have worked together, because we are very, very concerned about the health and well-being of our students, teachers, and staff. And that has been always our priority, the same as the rest of the community. We recommended the use of face masks. We recommended the distancing. We recommended the washing your hands and all other non-pharmacological interventions. But with the vaccine available to us, that has been the best way that we have to prevent some of these outbreaks and some of these rising numbers that we have. This pandemic has become a pandemic of the unvaccinated. About 2 out of 3 people that get infected are not vaccinated. 9 out of 10 people in the hospital at this moment do not have the vaccine. That's why we make it possible to bring the vaccine to each and every one individual that requests the vaccine. We work closely with school districts to have the vaccine available in the schools. They have a great tool, which is the rapid testing, to promptly identify those cases so they can be isolated. That's the way that they were able to identify that they were having an increase in the cases and rapidly acted upon that. We've been working very closely with them, and that's the way that we continue to do it across the community. We strongly encourage everybody to go and get the vaccine. If you have received your booster, go and get your booster as well. There have been plenty of events that we have available for the people to receive the vaccine. And the way to fight this pandemic is going to be getting vaccinated. The vaccine has been proven to be safe and effective. We had some forums that you can also watch, in which local experts talk about the safety and effectiveness of the vaccine. There's plenty of concerns from parents about giving the vaccine to their children, but one thing that I can tell them is that if you give the vaccine to your children, you're going to be protecting them, but also you're going to be protecting your grandparents, all the other extended family that you're going to be gathering in this holiday season, because this holiday season is going to be so particularly important, and there's so much more that we need to be thankful for. So if you're going to be gathering, our recommendation is encourage everybody to be vaccinated. Have your close, small family gather, celebrate in a safe and healthy way. And that's the way that everybody is going to continue celebrating many, many, many years to come. So for those of you that vaccinated, thank you. The face mask mandate, we're awaiting the court results, but we haven't stopped encouraging people to wear the mask. Whether you're unvaccinated or vaccinated, it doesn't matter. That's the way that you're going to be protecting your family. That's the way that you're going to be protecting yourself. And a mask is something that is a public health tool that we have to prevent that infection, not a political statement. That's what we continue to recommend in such a way. So regardless of the decision of the court, we're very respectful of the court, but we continue to recommend those interventions that we're going to be needing to pull our community through, especially this winter season that we have influenza. We have other respiratory viruses that also people have seen here in the schools as well. One thing that is important to remind the parents is that if you see that your child is sick, don't send them to school, because that's the way that they're going to be infecting other kids. The schools and all the school officials have worked very, very hard in polishing and having those safety protocols and plans. that are meant to keep everybody safe and healthy. Rapid testing, cleaning and disinfection, isolation and quarantine, wearing your mask. That's some of the elements that are going to be building that health and safety plan that the schools have. So thank you again, and I'll be happy to answer any questions.
Dr. O, you just mentioned, some of the rates here, and people who are unvaccinated are typically the ones, going to hospitals and being sick. Can you talk to the enthusiasm there might be for boosters? Are there as many people getting their boosters as there were getting their initial and second doses?
Well, we're seeing that the people are getting their boosters, and we're very happy that people come and get their boosters. If you show and request a booster shot, then we're happy to provide it. And it's actually regardless of the place of residence, because there's going to be people from New Mexico. There's people from Mexico come and request the vaccine, and that's why we want to make the vaccine available for all of those. So the booster is another way that we're finding that is going to be protected against those breakthrough infections, and particularly those that are vulnerable, which is the people that have diabetes. Many of us here in our community have diabetes, high blood pressure, other conditions like asthma. Those are the ones that makes us more vulnerable, and those are the ones that if we get infected with COVID can end up in the hospital developing some complications. So that's why we continue to stress that importance of the vaccination. Complete your vaccination schedule also, because some people might be afraid of the second dose because of the reactions that they have heard in other people. But get your second dose. The studies show that if you complete your vaccination schedule, your level of protection and effectiveness goes a lot higher. And if you get your booster because the immunity wanes, that's even a better way that you're going to be able to be protected and protect your loved ones once you celebrate those holidays that are coming.
And what are some of your concerns, given that we're getting into the holiday season, and people are going to start being able to, come from deeper parts of, Mexico to come and visit their families. So, they could take it back, or it could come. What are some things, I guess, that the public health department is looking at, and trying to get to the community about this month and next?
Yeah, my concern is the unvaccinated individuals. How can we reach to those? That's why we try to educate a lot of those that still have any questions, that still haven't found the right information, so we can be able to provide that information. That's why we bring the vaccine also and make it very accessible. And we've gone to many other places. We've thought out of the box, so we can see how we can capture a lot more. That's why we went to the grocery stores, supermarkets, close to the bridge. A lot of the people that are crossing from Mexico, they're going to be allowed to cross if they are fully vaccinated. So we're not going to be seeing that many people not fully vaccinated, but in a whole region, because we cannot separate just our city from the rest of the region. Our region has done a wonderful job vaccinating themselves. We have the highest vaccination rate in the state of Texas in a larger metropolitan area. So I'm very proud of my community for doing that. So we need to continue focusing on those that haven't received the vaccine. We know that there's going to be people that we're not going to be able to convince, but the rest of the people that we can convince definitely will continue to work tirelessly to convince them, provide the right information, and that's the way that we're going to be protecting each other. Our community is very resilient and has come together in times of challenge. This is no different, and that's what we want to stress that, and we have the right tools available to all of us, so let's use those.
So I feel like, choosing to have some schools go to remote learning is a pretty big decision, and it's something that has parents across the borderland concerned. Is this something that parents should be preparing for in other districts and other schools?
Yes, definitely, because this is not just exclusive to Canutillo. It happens all across the county that we see that the numbers are rising, and you're going to be finding positive cases in schools. So how can we as parents protect our children when they go to school? Because they really need their in-person instruction. They need the schools. We need for them to continue learning, and the best way is to have them in schools. And the best way is, one, vaccinate them. Now we're vaccinated 5 to 11 years old, and we have been vaccinated all the 12 years old and older. So middle schoolers and high schoolers should continue being vaccinated. Now we're starting with elementary school children, and also if parents haven't been vaccinated, please do so. A lot of these children, they get infected from their household, from those that were unvaccinated. Either they had a family reunion, whether they had another parent that cannot stop working. So there's many ramifications from being infected because people are going to be having to stay home in isolation and they cannot work. Those are going to be lost wages. Those are going to be that opportunity that they have to provide to their family. So the best way to do it is protect ourselves, prevention, 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 and we've mentioned so many times about this.
So with the data you're seeing, is schools returning to remote learning a reality we might be seeing very soon?
Well, this period of remote learning is going to give an opportunity to different bands continue finding those positive ones so we can keep them in isolation. They're going to be very vigilant, as well as other schools have been doing all the rapid testing so they can find those that are positive, isolate them so they would prevent to spread the infection of the COVID. When you're vaccinated, the chances that people are going to get sick are a lot lower, so the risk is lower for everybody else that is around us. But we really need a very high number of vaccinated individuals, whether students, parents, or members of our community, to be able to protect the whole group.
But we could see schools shutting down and going back to remote learning?
Well, if the cases rise in any particular school, definitely that's what's going to be expected to happen, because we need to definitely isolate those cases.
And then could you talk to me a bit about why we are seeing that increase in pediatric cases?
Well, one of the reasons is because we barely started to vaccinate those that are 5 to 11. We still have some group of those children or teenagers that haven't been vaccinated as well. So as mentioned previously, the unvaccinated are the ones that are driving the numbers up, hospitalizations, and even across the country we see that the pediatric admissions to the hospital has risen sharply. The number of positive cases also have increased in the pediatric population less than 18 years of age, and we cannot separate just the children from the rest of the family. So when we see young adults, we're going to see children getting infected as well. And our community has multi-generational homes. We're going to have those that are elderly, high risk, getting infected even if they're fully vaccinated because somebody didn't receive the vaccine. So that's why we really need to work and look at the situation in many ways and in many prongs, and that's how we've been working in a multi-pronged approach to be able to tackle the whole pandemic and be able to pull through. And hopefully this winter season with influenza and other respiratory viruses, if we go and pull through and continue vaccinating more people, then we'll be able to continue being successful.
And no longer having masks in the classroom, is that playing a role in this also?
Well, definitely not wearing masks is another factor, but we strongly encourage everybody to send their kids to school with a mask. Nobody likes a mask. We don't like the mask when we're in the healthcare system, in the healthcare environment, but because we want to protect our patients, we want to protect our loved ones, we can wear the mask, and we're all already used to the mask. And I see children as young as 2, even a little bit younger, wearing the mask properly, even better than adults. So we're happy when we see our community still wearing the mask when they're going indoors. There's going to be an influx of people because of the holiday shopping. That's another one of our concern also. So if you're going to do that, just plan ahead. Send one of the members of the family to do the holiday shopping, or do it online, better off. Practice distancing when you can. Go at the times that there's going to be less people. Get vaccinated before you're going to be celebrating the holidays, and we're going to be having a very successful holiday season.
And with this court case that, if it passes, might allow, masks to be back in the classroom, as a health authority, is that something that you're going to be pushing for?
I couldn't understand the first part of the question.
No, it's okay. With this court case that might allow masks back in the classroom, as a health authority, is that something you're pushing for?
Well, definitely. As a health authority, I push for all the elements that we have that are scientifically proven to prevent the spread of a disease or a contagious disease, and that's part of my job, to protect my community from any threats, whether it's biological, whether it's a pandemic, and that's one of the tools that we have available. And when we use a combination of tools, meaning the face mask, the isolation and quarantine, the vaccination, the monoclonal antibody infusion for those that are infected, that combination of elements are going to help us a lot more than just a single element by itself.
But at the end of the day, it will be up to the districts to decide whether or not to enforce a mask mandate?
It all depends what the court decides, but we continue to strongly recommend the mask. We continue to work very closely with all the school districts in the region, public and private. and we continue to provide that assistance and support because we're all members of our community. Schools are doing a wonderful job of protecting our students, and I want to reassure that to all the parents, and their safety plans are there in place, and they continuously polish those plans to make it better. And again, every challenge brings an opportunity to do things a lot better.
Thank you, Doctor. Dr. Ocaranza, now that vaccinations are open for kids, have you seen parents hesitant or, not wanting to take advantage of those vaccinations for kids?
Yeah, definitely, because we as parents want to protect our children, and they want to see and they want to hear from physicians, from a respectable source, what's going to be the take. Do we vaccinate? And that's the common question that we got. Do you think that I should vaccinate my children? For me, it's a capital letter yes. Definitely, that's the way to vaccinate because, as mentioned previously, we protect in many ways. One, the children, but also the rest that are taking care of those children. So we cannot separate those children from the parents, from the grandparents. So definitely the vaccine has been proven to be effective, has been proven to be safe. The risk of myocarditis or inflammation of the heart, that's something that they look a lot closer because of that finding that they saw in older teenagers and young adults. And that's why it took a little longer for the vaccine to be approved because they needed to show that the association of the myocarditis is not going to be posing a risk that is outweighing the benefit of vaccine. So the benefit of the vaccine clearly outweighs the risk of any other reactions to the vaccine. We continue to observe closely how in a mass immunization is going to be causing any if any reactions to the children, but definitely we're all very happy that the vaccine got approved. We know that it is a life-saving tool that we have, and we continue to recommend it as any other vaccine.
Thank you.
Everybody good?
Can you talk a little bit about the partnerships that we have with all the school districts in terms of getting vaccines out there to pop-ups at school districts?
Yes, definitely. One thing that we've done is working very closely with the school districts so they can provide the vaccination here within campuses of the schools. Canutillo has their own vaccination clinics and pop-up events, and all the rest of the school districts have done the same. They're working either with the city, with the county, with other providers to be able to bring the vaccination to the schools. The schools serve as a hub for their community and their neighborhoods, so we recognize the importance, and that's why we have partnered with them to provide the vaccination to anybody who comes and requests the vaccine. And thank you again for being here, and thank you, Dr. Galaviz.
Si quieres por ahorita te puedes quedar ahí para que lo podamos hacer en español.
Todo en español, por favor.
Nomás estaba esperando que ellos terminen, pero...
Ándale. Buenos días y muchas gracias a todos por venir. Y más que nada le agradecemos al doctor Galaviz la invitación que nos dio de estar aquí presentes con todos ustedes. Como todos ustedes saben, una de las escuelas del Distrito Escolar de Canutillo tuvo que cerrar unos días más que nada por el aumento de casos de COVID-19 en estas escuelas. Pero una de las cosas que queremos mencionar es de que esto no es exclusivo al distrito de Canutillo, esto es algo que estamos viendo en todo el condado y en toda la región, porque lo vamos a seguir viendo en todas las demás escuelas de la región. Estamos trabajando muy cercanamente con los distritos escolares públicos y privados para poder proporcionar las guías y recomendaciones que se necesitan, y con ese gran esfuerzo que hemos estado trabajando juntos desde el inicio de la pandemia para poder proteger a las comunidades, sobre todo la comunidad estudiantil, la de maestros y la comunidad en general. Hemos trabajado muy arduamente para poder brindar la vacunación a todos aquellos que desean, y la vacunación se ha hecho posible en muchas de estas escuelas y campuses para poder traer la vacuna a las colonias y a donde más se necesita, con el esfuerzo de poder llegar a más gentes. Les agradecemos a todos aquellos que ya se han vacunado, y les recordamos que también la dosis de refuerzo está disponible para todos aquellos que así lo desean y que están indicados para recibirla. Estos números que hemos estado viendo últimamente son el reflejo de toda la gente que no está vacunada. 2 de cada 3 personas que se infectan en estos momentos en El Paso no tienen la vacuna, y 9 de cada 10 personas hospitalizadas no cuentan con esa vacuna. es una estadística extremadamente importante en la cual vemos que la vacuna sí trabaja, es efectiva, y queremos recordarle a todos aquellos que todavía tienen alguna duda de que la vacuna es segura. Mucha de la información que reciben por redes sociales necesitamos brindarles otro tipo de aclaraciones y por eso hemos puesto foros de educación para la comunidad. Tenemos información adecuada para todas aquellas personas que así lo necesiten en nuestro portal y en nuestra página web epstrong.com, y queremos llegar a cada vez más personas que no se han vacunado hasta estos momentos. Cualquier duda y aclaración, tenemos todos esos elementos para que puedan hacer la decisión, y sabemos que mientras más personas vacunemos, mejor vamos a poder en esta batalla contra el virus del COVID-19.
Doctor, ¿cuáles son los factores que han afectado para que a lo mejor estén aumentando los casos aquí en primarias o en las escuelas?
Bueno, los factores que afectan más que nada para el aumento que hemos visto de casos es de que muchas de estos casos no están vacunados, y no están vacunados los padres o no están vacunados los hermanos mayores. Hemos estado ofreciendo la vacuna para todos aquellos que están en la secundaria y en la preparatoria, que son a todos aquellos mayores de 12 años. Y más que nada por eso hacemos hincapié en la vacunación. Ahora que tenemos la vacuna disponible para todos los niños de primaria que son entre 5 y 11 años de edad, exhortamos a todos los padres para que vayan y reciban su vacuna y le apliquen la vacuna a sus menores de edad. Esa es la mejor manera que vamos a poder prevenir muchos de estos casos, aparte del uso del cubrebocas y no mandar a nuestros hijos a la escuela cuando están enfermos. Sabemos que muchos padres no tienen el lujo de poder quedarse en casa con ellos cuando están enfermos porque tienen que trabajar, pero hay que tomar conciencia, y esa es la mejor manera que vamos a evitar muchos más contagios, sobre todo cuando los mandamos a la escuela enfermos. Las escuelas tienen sus planes de prevención y seguridad, los cuales han estado mejorando, y hemos colaborado muy cercamente con ellos para poder proporcionar este tipo de protección a todos los estudiantes, maestros y la comunidad en general. Estamos orgullosos de todas las escuelas que han trabajado arduamente y muchas horas en poder proporcionar esto, porque sabemos la importancia que tiene de proporcionar la educación de una manera presencial. No queremos interrumpir esta educación de manera presencial, y por eso pedimos que la prevención es la recomendación número 1 que estamos dando.
Sabemos que es muy poco el tiempo, pero ¿qué respuesta se ha visto de la gente ahora que ya están vacunando a mayores de 5 años? ¿Sí se ha visto mucha demanda de esta vacuna o no tanto?
Sí se ha visto demanda de la vacuna para niños de 5 a 11, y por eso tuvimos un evento el día de ayer en el cual lo hicimos muy accesible a la gente para que usando el día que tenían libre de clases y de trabajo pudieran venir a vacunarse. Seguimos viendo que aumenta el número de personas vacunadas, y inclusive la tasa de vacunación en El Paso sigue aumentando y no se ha estacionado, que es algo muy favorable y nos da la esperanza de que seguimos avanzando en esta lucha que tenemos contra la pandemia.
Sin embargo, se siguen viendo los casos, siguen aumentando, ¿no? ¿Cree usted que este tipo de situación de cerrar las escuelas, volver a remoto, pueda volver en un futuro si siguen aumentando así los casos?
Tenemos que encontrar el balance entre la seguridad y el bienestar de los estudiantes, pero también el beneficio que tienen de la educación presencial. Entonces, el mandar a remoto a los estudiantes por unos días es una de esas soluciones que tenemos, en las cuales aislamos a todos esos estudiantes, tratamos de identificar de una manera rápida a cualquiera que salga positivo para poder aislarlo y mandarlo a la casa y poder continuar con esta instrucción presencial, la cual sabemos que va a dar muchos beneficios y no queremos interrumpir en un futuro. Si pudiéramos pasar esta temporada de invierno y llegar a las vacaciones de Semana Santa, podemos decir que hemos avanzado bastante y vamos a poder disfrutar una vez más de darles el beneficio de la educación presencial y manteniendo a la gente más que nada sana y viva.
Perfecto, ¿algún consejo a los padres nada más para, a lo mejor prevenir que esto siga sucediendo?
Claro que sí, uno de los mensajes a aquellos padres, que no tengan miedo de mandar a sus hijos a la escuela. Tenemos que enseñarles a cómo prevenir, y la mejor prevención es como padres, proporcionar esa vacuna a nuestros hijos, que eso es lo que los van a mantener sanos. La otra es no mandarlos cuando estén enfermos, y acostúmbrenlos a usar su cubrebocas. Seguimos recomendando el cubrebocas aunque la corte o el gobernador no deje el poder mandar el cubrebocas, pero sabemos que esa es una de las herramientas que tenemos que funciona. Está comprobado científicamente que disminuye la velocidad de infección, sobre todo cuando estamos en lugares cerrados y en lugares aglomerados. Entonces, síguelo usando. Los niños usan el cubrebocas mejor que ni los adultos.
Perfecto.
Dr. Earl, I just have one last question I forgot
Yes.
to ask. Sorry.
Definitely.
Give me 1 second. Just gonna do it on the phone because it's not working. Okay. Sorry.
We do have our public health emergency manager here if you guys have specific questions for her after Dr. Ocaranza.
Okay. Do you think it was a wise decision for the district to continue hosting the basketball game after they'd announced they'd be shutting down to remote learning?
Well, there are many factors that should be considered when you have an event of such magnitude, but definitely the school officials have done everything in their possibility to ensure the safety and well-being of their students.
Okay, so you stand by it? You think it was fine?
We provide the recommendations and we trust that Dr. Galaviz is going to be ensuring the health and safety of their students.
Perfect. Thank you, Dr.
Thank you.
Falling, I love it.
¿Lo quieres?
Sí, pero si lo podemos hacer uno a uno, es que mi micrófono queda muy abajo y me da miedo que no se vaya a escuchar bien.
Hi, do you have a question?
Si quieres, lo podemos estar acá.
Deja ver si no tiene nadie, si no tienen
I
inglés.
actually think I'm okay, unless there's anything you feel that needs to be mentioned.
No, I guess just invite all the parents and I guess to be patient with us, collaborate with us. We're doing the best that we can. And of course, we really want to send the message that if the kids are sick, please do not send them to school. That's pretty much, I guess, the main message that we want to be able to send them.
Perfect. And then, would you be able to answer about like rapid testing? Is that I guess being funded by the state, or how does that work?
Yeah, we have a grant program where we are funded to provide rapid testing in all the schools.
Okay, perfect. Thank you so much.
Yeah,
I appreciate it.
¿Se puede venir para acá?
Sí, exacto.
Hola.
Hola, buenas tardes.
Buenas.
Un poquito
Sí,
más.
está bien.
Está bien.
Si quiere lo voltea a ver a él.
A
Yo
él,
le hago
ok.
las preguntas.
Ok, perfecto.
¿Listo? ¿Quieres que te tenga el micrófono?
Primeramente, ¿tu nombre?
Soy la doctora María Fuentes y soy la manejadora de emergencias de salud pública del distrito de Canutillo.
Habla de lo que está pasando aquí en Canutillo. ¿Por qué piensas que a lo mejor los casos están aumentando tanto que tenían que cerrar las escuelas?
Bueno, estamos teniendo un aumento de casos, ¿verdad? Son muchos factores, no podemos nada más culpar uno solamente. A veces hay falta de utilizo de mascarillas, la gente a lo mejor no se está vacunando, a lo mejor no estamos guardando la distancia. Son muchos factores que tienen que ver e intervienen con el efecto de que hay un aumento de casos. También estamos viendo que muchos de los niños que están enfermos están acudiendo a las escuelas, entonces nosotros sí queremos mandar ese mensaje muy importante a los papás. Si ven que sus hijos tienen síntomas, cualquier tipo de síntomas, es mejor que se esperen, hablen a la enfermera, los lleven a un pediatra antes de mandarlos a la escuela y no estar seguros si es COVID o no es COVID.
¿Cómo están ustedes monitoreando estos casos? ¿Cómo se dan cuenta del aumento? ¿Le piden a los padres? ¿Hay alguna página? ¿Cómo están ustedes monitoreando todo
Ahorita para mí lo más importante, esencial, que creo que es parte de mi trabajo, es estar informando a la población. Para mí, entre mejor informados estemos, mejores medidas de prevención, estrategias seríamos capaces de aplicar en las escuelas. Yo siempre hago un reporte semanal que subimos en nuestra página del distrito. Ahí reportamos el número de casos que la gente no está vacunada, cuáles de esos casos es gente que son estudiantes, son empleados, y básicamente ahí la gente tiene acceso a la información. Ahora empezamos a notar un aumento de casos. Entonces decidimos simplemente cambiar un poquito la estrategia y aplicar a lo que viene siendo realización de pruebas rápidas en todas las escuelas, porque de esa manera, en cuanto no observamos un caso positivo, tenemos la capacidad de mandar al niño rápido a la casa, aislarlo y no represente un riesgo más para la escuela o la comunidad.
¿Las pruebas rápidas las están haciendo de manera semanal o a todos los estudiantes, todos los empleados?
Depende del número de casos. Si tenemos menos de 3 casos por escuela, estamos sugiriendo que la escuela ofrezca un día de pruebas rápidas. Y si vemos que el número de casos es más de 3, estamos ofreciendo 2 o 3 días de pruebas por semana en las escuelas.
Platícanos un poquito el cierre que se da el día de hoy. ¿Es para sanitizar a la institución? A lo mejor para darle tiempo a los padres de que si ven algún síntoma, que para este cierre de qué sirve.
Para mí, la verdad, creo que manda un mensaje muy positivo. Yo sé que mucha gente es una preocupación, a lo mejor se asusta o se alarma, pero realmente para nosotros es un mensaje positivo porque al contrario, si estamos notando que hay un aumento de números de casos, es actuar rápido. Vamos a cerrar un día, vamos a limpiar la escuela, pedimos a los papás, por favor, si están enfermos, llévenlos al doctor, no los manden. Es como también mandar un mensaje a la población de que esto no se ha acabado. Es importante aplicar todas estas estrategias preventivas que son capas, ¿verdad? Si yo me vacuno, si yo guardo mi distancia, si yo estoy vacunada, más voy aumentando esa fuerza de protección contra mí, contra el COVID. Entonces, las medidas de prevención funcionan, por eso son preventivas, ¿verdad? Entonces, creo que es una respuesta muy efectiva en colaboración con el Departamento de Salud para asegurar de que damos ese espacio de seguridad a los estudiantes.
Perfecto, ¿algún mensaje ya por último a los padres, a lo mejor que sigan tomando estas medidas?
Claro, pueden visitar nuestra página web de Canutillo, ahí estamos poniendo toda la información actual, semana por semana, pueden seguir el número de casos. También los invitamos, siempre estamos teniendo eventos de vacunación. Ya la otra semana vamos a tener vacunas de 5 para arriba, los invitamos a que vengan. Si no se sienten seguros, está bien, pero sí los invito a que se informen, lean, le pregunten a su médico para que tomen una decisión basada en información adecuada. Así es que eso.
Ahorita, cuando